Hello, we'll discuss about the rise of Omicron, the COVID new variant, Omicron subvariant, what are the symptoms, and what are the precautions we have to take. Omicron B5.7, it was in circulation in the world for almost a year right now. The virus continues to grow and produce new variants, as you can see in this diagrammatic representation. There are more than 500 sublineages of Omicron are circulating right now. So some of my patients have asked me questions. I want to address those questions so that it gives clarity for rest of the people. And one guy has asked if Omicron is less severe than Delta, why people are dying. If you see the Omicron, it is producing the same clinical spectrum like that of the other people. Like what it means is majority of the patients are asymptomatic, and we have also have symptomatic patients and some severe patients, and also we are seeing deaths. The transmission of the Omicron, which is seen in orange here, is more when compared with the Delta virus among the household members and also among the outsiders. This is as per the Nature article which is published recently. So it is still a dangerous virus. It's full spectrum of the disease, and we should be careful. Then the someone was asking what are the risks for severe COVID with Omicron variant. Underlying comorbidities like uncontrolled hypertension, uncontrolled diabetes, chronic kidney disease, chronic liver disease, heart failure, chronic rheumatological conditions. These patients are at risk of severe COVID, and immunocompromised patients like HIV patients, and advanced age and those who are not vaccinated for COVID, their risk of severe COVID with Omicron. You can see the Omicron surge here as per this Statista, and the source is World Health Organization latest report. Now we have another question. If Omicron spreads faster, do we need any protection to prevent spread of the virus, or we can uh, let the virus go and infect everyone? No, we can't do that. So Omicron has overtaken Delta by its easy transmission. People are getting sick all the time. We also are seeing or listening on the TV that we are getting sick cases and a lot of people are dying. We cannot take it lightly. And one patient was asking this question: I am already vaccinated. Does it help me in any way? Or should I advise vaccination for my family members and friends? Vaccinations does help. It prevents severe disease and also death. Sometimes it also prevents the spread of the virus from one individual to other individual. So keep yourself safe and others safe and prevent the spread of this Omicron by taking vaccination. Meet your nearest COVID vaccination center and get yourself vaccinated. So you can use mask and wash your hands often and maintain a physical distance. Check your health and temperature daily. If you think that you require medical assistance, please do meet the nearby healthcare professional and seek your advice. Why is it important to prevent transmission? The risk of the severe disease is there, this we have already discussed, and we still don't understand what are the what are the implications of this COVID. Like we have long COVID, and we also have a lot of complications. We don't know how this variant is going to behave. So, and also we also don't know what new complications are going to occur, and so it is better to prevent this. And it is important to prevent transmission of the virus because we already have less healthcare resources, and thanks to the existing government, because of the government initiative, majority of the people are vaccinated right now, and healthcare services are also improved, but still we have to be careful. Will Omicron will be the last COVID variant? Certainly, Omicron is not going to be the last variant. As we have seen in the previous diagram, the virus starts growing, multiplying, and new variants will be coming all the time. When the new variant has the capacity to infect easily, then it usually overrides the previous variant. More the circulation of virus, more will be the opportunities of the virus to change or undergo mutation. It is real that the new variants will keep coming, but we don't know how these variants behave in future, whether they spread more, whether they spread less, whether they cause severe disease, or whether they cause just a mild disease like a cold and it go off, or whether it cause severe disease by escaping the immunity. We are not sure about it. This is an important illustration. We should all remember this illustration. The multiple layers improve success. This is basically a Swiss cheese respiratory pandemic defense. What it means that if you can see here, physically maintaining distance at home, hand hygiene, and putting a handkerchief when you're coughing, and avoiding crowded places or limiting the time you spend in the crowded spaces. This is personal responsibility. And we also have a shared responsibility, that is ventilation, outdoors, air filtration, quarantine, and isolation. So, the message from this multi layer pandemic defense is we have to be careful on an individual front and also on the social front. Then only the virus can be prevented from transmission, and uh, and the death rate will also be improved. So this diagram is very important. I am repeatedly emphasizing this diagram so you understand the importance of individual healthcare, societal healthcare, and the government measures, taking vaccination and testing immediately when you have suspicion and getting treated immediately. Then that can prevent the spread of the virus. So we are almost 4 years into pandemic right now, and we are living together or cohabitating with COVID-19. That is what many people say in a funny way. So how is our future going to be? See, we can reduce the spread of the virus and save lives with this multi-layer uh, approach, or you can say multi-level intervention approach. The individually we have to act, and also socially also we have to strengthen ourselves in fighting this deadly disease. And also we have to deal with respiratory infections like tuberculosis, common cold, and influenza. Because of the cold seasons, the influenza is also on rise nowadays. So we should be very vigilant, and we should have a suspicion of COVID caused by Omicron variant as well. Not only this, we have been dealing with climate changes, global warming, and deforestation, cyclones, flooding, and raining, and all the natural calamities, and the recent wars that have been taking place, droughts. So we are dealing with a lot of issues at this point of time. But still, we have one more frontier to cross, that is COVID-19. I think with strong social and community participation, we can control COVID and we can save ourselves. We, we are all fragile. We should remember that we are all fragile. Though human has conquered and human has invented a lot of things, there is a point that we have to realize that we are fragile. We have to be kind to each other. We have to lend a supporting hand to each other. Always see compassionately your fellow persons who is suffering from COVID. If possible, provide some assistance in the form of food uh, while following precautions, and also give them moral support over the connected devices. And uh, this will help the people, uh, the giving a moral strength and moral support in recovering from this COVID illness. Now, I also have a question. Like one person was asking me, I have taken one vaccine, and what vaccine should I take as a booster? Should I take a booster, or if so, uh, should I take the previous vaccine or the new vaccine? That was the question. For this, I was referring the literature. This is the statement given by CDC from the government. They're allowing that you can mix and match the vaccine boosters. That is what there is a recommendation. That is, even if you take the other vaccine, you can take uh, the vaccine and as a booster to improve your immunity. That is the case. So don't worry about taking the same vaccine to boost immunity. You can mix and match, still your immunity will improve. Now, there are no much safety concerns or no much adverse reactions when you take a different vaccine. But still, please discuss with your COVID doctor and take a decision. And now the take-home message, I again want to emphasize on taking a proper mask, ensuring there is a good fit, the mask fits snugly on your face, and that is how you prevent the spread of COVID. Let's fight together and save ourselves in this pandemic. Thank you.